Basically, right now I'm studying a pharmacology along with the medicine, and there is a one thing that came into my mind that is known as the Tourette syndrome. But what is the meaning of the Tourette syndrome? Basically, there is a Tourette syndrome mean abnormal, sudden, uncontrollable movement is known as the Tourette syndrome. From where did we get the mean like the name of the Tourette syndrome? Basically, there was a scientist in the French. Who discovered this syndrome? Basically, what happened? There was a 12-year girl that came into the OPD of that doctor, and she has a little bit tremors in the hand. But the doctor tried to give the treatment with the approach of the multivitamin because there are some kind of a disease that is caused by the deficiency of the multivitamin, and they have some kind of symptoms like the tremors. So the doctor tried to approach giving multivitamin, but the condition was not treated. So after that, the doctor realized that this condition is different kind of a things. So he tried to do research on that, and the doctor found that this is known as the Tourette syndrome. He gave the name of the Tourette syndrome because the doctor found that, and so that's why he think that there was some kind of a problem in the neurons. So that's why this condition is happening. Sudden, abnormal, involuntary, uncontrollable movement. Tourette syndrome can be seen in early adulthood, like 14, 15, 16 years of the children, and 10 to 15% of the children have that, and we can say that what can be the main reason for it of the development of the Tourette syndrome after the adult? Basically, if you have a lot of caffeine intake, if you use stimulant like methylphenidate, amphetamine for the ADHD, so that can cause the Tourette syndrome. But we don't know the main etiology of the Tourette syndrome. We don't know that what disturbance in the mind or what disturbance between the neurons are causing the Tourette syndrome. And if I talk about after adult, this is very rare to be found. Like 10,000, if we compare to 10,000 people, only one person will have the Tourette syndrome. So that's very rare to find the Tourette syndrome. But there are people, very famous people, that have Tourette syndrome. Like Billie Eilish is the most famous example of of the person that having Tourette syndrome. Or you can say that Louis Capaldi, also a singer, Scottish singer who also have the Tourette syndrome. Now, if you talk about the what kind of Tourette syndrome, how many type of the Tourette syndrome we have? We have two type of the Tourette syndrome: the motor and the vocal. In motor Tourette syndrome, basically like the patient will produce abnormal kind of a sound like barking, like not motor. It's not voice. It's related to the voice. In motor, the patient will have jerking of the hand again and again, repetitive, uncontrollable, sudden movement of the hand is known as the motor Tourette syndrome, and the patient can have shrugging of the shoulder like that again and again, again and again, again and again. This is uncontrollable, sudden, involuntary, and abnormal movement. So this is the shrugging of the shoulder that is mean the patient has Tourette syndrome, or the patient have like a movement in the fingers like this again and again, again and again, again and again. So this is the motor Tourette syndrome. In case of the vocal Tourette syndrome, the patient will produce abnormal amount of the sound which is uncontrollable, involuntary, and sudden and abnormal. So the patient will produce like sound of barking, or the like he will produce little bit specific kind of a sound from the mouth again and again, again and again. So this is known as the vocal Tourette syndrome. Now, as I told you, there is etiology. There's no, we don't know any kind of main reason why this syndrome is happening. We don't know that. But if you talk about the pharmacological therapy of this Tourette syndrome, basically what happened, we try to give different kind of a medication, and there was a specific one kind of a medication that worked very betterly, that is known as the antipsychotic. What happened, and in antipsychotic we try to give haloperidol, risperidone, olanzapine. Basically haloperidol is the first line of choice in the case of the Tourette syndrome. And what do antipsychotic drug do? Basically, this is the postsynaptic neuron, this is the presynaptic neuron. The presynaptic neuron will release the dopamine, and here we have the dopamine receptor that is known as the D2 or D1 receptor. So it block the receptor, it block the dopamine receptor. So that's why there will be no reception of the dopamine, and so automatically there will be reduction in the dopamine. So that's why we don't get excitement feeling in the body. And if the patient have like a little bit depression just because of the Tourette syndrome the happening, and so we can also combine the therapy with the selective serotonin reuptake inhibitors like fluoxetine, paroxetine, paroxamine, fluoxetine, paroxetine, fluoxamine, citalopram, citalopram. So you can also give the polypharmacy in that case too. But if the condition is not treated, you can also give a little bit antihypertensive drug like to control the movement. But I prefer to give clonidine. Some also prefer to give propofol, not propofol, pentaprol. I don't know the meaning, or I forget the drug. But I prefer to give clonidine, which is it is the alpha 2 receptor antagonist. So yeah, this is how the Tourette syndrome, and this is how you can treat it. Uncontrollable, sudden movement is known as the Tourette syndrome. Most famous person, Billie Eilish and Louis Capaldi. You can give antipsychotic haloperidol, risperidone, olanzapine. You can also add selective serotonin reuptake inhibitors. But I think if you try to give medication like benzodiazepine, it will also work in the Tourette syndrome. So you can also give benzodiazepine. So this is how about, and yeah, just I was studying and I just finished my. eh, That's what I want to teach you, Tourette syndrome. Thank you. Goodbye.